Hello, everyone, and thank you very much. In fact, a big thank you to Andrew Mazzell for inviting me to speak here at today's Alcohol Change UK 2023 conference, Opening Doors, Improving Access to Alcohol Support. It has been really interesting listening to all the other speakers so far today, and so I'd like to continue by just pressing on with my own presentation. So my name is Gary Meek, and I am the CEO of the Glasgow Council on Alcohol, or GCA as we're more commonly known. GCA has provided community-based alcohol and drug intervention since 1965 and is the oldest established council on alcohol in Scotland. GCA support individuals and their families who are experiencing poor mental health and commonly present with multiple complex issues linked to negative life experiences which impact the underlying issues caused by addiction. GCA's person-centred ethos and care planning process supports the individual to identify, prioritise and achieve their goals. Each person's journey is personal to them, and therefore GCA is flexible in its approach. We respond to individual need and continually consulting with the individuals in receipt of these services. At GCA, we adopt a multifaceted approach and use innovative and creative methods of engaging with individuals to enable them to access our services. We recognise the value and benefit to our organisation through the employment of individuals from a variety of backgrounds and with additional needs. We found that with the correct support, employees are able to flourish in their roles. We recognise the value in peer role modelling within the workplace, for example, and we operate a flexible working policy to help individuals who have protected characteristics and may require adjustments such as maybe working from home, working hours to suit the individual need, etc. This policy also works to provide a family-friendly environment and takes cognizance of the duties of carers and the importance of that work-life balance. As a supported employer, we have taken the proactive step when working with individuals who have additional needs that we have personalised support plans within their personnel file, and this ensures that any issues may be resolved in advance, minimising the risk of traumatisation from prior negative employability experiences. Much of this important work of GCA is carried out by our dedicated volunteers, who come from a range of complex and diverse backgrounds where mental and physical health can be a barrier. GCA was the pioneer council on alcohol in the UK to recruit, train, deploy and supervise volunteer counsellors. In fact, we're privileged to have over 100 volunteers currently engaged with us and over 35 experienced counsellors working across Glasgow City who provide a valuable and cost-effective support service. GCA prides itself and places great value in the extensive contribution volunteers bring to the organisation, and in doing so, provide continuity and promote employability outcomes for Glasgow's citizens. As a supported employer, meaning supported employment referring to service provisions wherein people with disabilities, including intellectual disability, mental health, brain trauma, amongst others, are assisted with obtaining and maintaining employment, with all paid staff in GCA being paid at the Scottish or the Glasgow living wage, currently £9.90 and going up to £10.90. Glasgow is a guaranteed employer and was nominated for award within the city within our work for this field. GCA is also a disability confident employer, having previously been awarded the double tick positive about disabled people symbol. So as the Chief Executive Officer of GCA, I've led the organisation to a profitability and sustainable position through a successful change management programme. The key aspects of my role, for example, are governance leadership, operational planning, management, partnership development and financial management. GCA is an organisation who works with individuals, families and communities to reduce the harm of alcohol and drugs, or should I say that is caused by alcohol and drugs. I'm also the chair of Elevate Glasgow, and I have led this fantastic service since its inception in 2015. Elevate is an employability public social partnership for individuals in recovery from problematic drug or alcohol use, which involves over 25 partner organisations, of which GCA is the lead and supports those partners. I am also a member of the cross-party group within Scottish Government, where I support campaigns for alcohol and drug awareness at a national and local level, working both locally and nationally on strategy and policy. I'm also the chair of the Scottish Alcohol Counselling Consortium, which makes a meaningful contribution to the communities across Scotland by improving counselling and support for individuals and their family who are affected by alcohol and other addiction. I'm also the chair of the Voluntary Sector Drug and Alcohol Agency Group, which is a partnership of voluntary and statutory sector to work together to provide a collective voice and influence the local strategy and operational directions of drug and alcohol services in the city. And more importantly today, I am the chair of Kinder, Stronger, Better, or KSB as we call it. This was set up in recognition of the health inequalities experienced by the LGBTQI+ community, particularly around substance misuse. The community members and professionals with lived or living experience being affected by their own or someone else's substance use came together to co-produce an initial campaign funded by Glasgow Council on Alcohol and a local fund called the Ripple Community Activity Fund. With a particular and special thanks to David Barber, who worked for GCA at the time and helped set up the project in the city. He was very dedicated to this cause. KSB aimed to raise awareness of LGBTQI+ substance use and help organisations to become more inclusive through training delivered to the volunteers around drug awareness and specifically chemsex awareness. This training was also to equip the volunteers with additional knowledge which could be used during assertive outreach as the project progressed. The KSB volunteers were recruited and have undertaken ABIs or alcohol brief intentions at events in Scotland. Other activities undertaken by the volunteers were delivery of alcohol awareness workshops, which helps provide people with information on safer drinking, organised sober events during Pride Month in particular. Some of the volunteers who underwent the training progressed on to gain employment because of this particular programme. This led to further LGBT training for staff at GCA, particularly focusing on issues that are specific to the community. KSB had a group of service users who developed the initial shape, and as a group of LGBT+ community members and professionals in Glasgow came together to design this service. Not only the service, but the drug-related health campaign, which was called #Kinder, Stronger, Better. They all had experiences using drugs or alcohol or being impacted by a friend, family member or partner's use. We've learned some things about alcohol and drugs the hard way, and we wish that someone had told us, so we were told. So the group stated that they are passing on what they've learned to us. We believe the communities of KSB are stronger together. The group agreed that working together towards community services that are visible and supportive of LGBT+ communities and people affected by their own or someone else's drug or alcohol use. We can be there for each other. We developed this idea and the principle, which now includes a website in partnership with GCA and Scottish families affected by drugs and alcohol. This was funded by the ADP, Ripple Monies, Alcohol and Drug Partnership, and the project is part of a wider working which was being undertaken by the Substance Use Partnership, which comprised alcohol, drug, LGBT+ family support members, as well as NHS and academic research. The group was set up in recognition of the health inequalities experienced by the community around substance misuse. Following on from research showing that the LGBT+ community face additional barriers to accessing drug and alcohol support, alcohol, drugs and the community, even though the majority of the LGBT+ community do not use alcohol and drugs in a harmful way, there are underlying reasons why people may develop a dangerous and harmful relationship with alcohol and drugs. Moving on, there are some quotes I would like to share. These are from the group in a segment we called Be Kind. Be kind when someone's drunk or high. They can be in pain. But they are in pain, which often means they're trying to numb, and try not to judge them for this. For some, drinking or using too much, too often on nights out or social situations. For others, it's a way to cope with the challenging life circumstances of isolation, trauma, mental health, and particularly childhood issues. Be kind. Booze and other drugs can be a great way to celebrate, liberate, self-medicate, but there's a tipping point from a recreational perspective to self-harm. Learn to spot your own tipping point. And this, for example, whatever the reason is, no one should be judged or stigmatised for using alcohol or drugs. Similarly, you should not be judged or stigmatised if someone you love is using alcohol or drugs. Be kind to yourself. If you chose to get wasted, make sure you're with a buddy you trust. Be sensible about where you get your supply. Remember, if you're already stupefied, you're more likely to make mistakes. Let's be #kinder, stronger, better together. LGBT plus people face challenges and circumstances that cisgender and straight people don't necessarily have to contend with. This can impact on the way some LGBT plus Q people use alcohol and drugs. For example, the community may face issues such as historic and ongoing inequality, discrimination such as homophobia, biphobia, transphobia, harassment, bullying or violence purely based on the basis of their own gender or sexual orientation, rejection by friends or family, having to hide one's sexual orientation or gender identity from others, including your own family, misplaced shame about one's gender identity or sexual orientation brought on by homophobia, biphobia, transphobia, or as we refer to that, shame-based trauma. Limited visibility of alcohol and drug-free spaces, particularly in an LGBT plus context. People experiencing multiple intersecting forms of disadvantage and oppression, such as homophobia, biphobia, transphobia, but also racism, ableism, classism, sexism, for example. Experiencing any of these is tough, and it's important that people are not only there for ourselves, but are actually there for each other. Another quote is, be strong. Discover your own limits with drink and other drugs. Your limit could be far different from your pal's. Be brave enough to tell your pal if you think they're going too far. Whether you're worried about your own drug use or someone else's, know that you're not alone. There are services, supports and community groups that can be here if you need it. I wake up feeling I had a great time last night. When that changes, I wake up and I can't remember what I did last night, or I feel shame about what I can't remember, or I'm crushed by my come down and hangover. These are signals to talk to someone about my drug use or my drinking. People want to find ways to connect with LGBT plus communities in spaces that aren't drug or alcohol focused. Someone else stated, I promise you can have a good time without being off your face. If there's too much drink and drugs in the scene for you, find another scene. There is life beyond the bar. And another few things that I thought were really valuable, and statements that I hadn't even heard before until this point, were things like don't sober shame. So let somebody be able to not drink or be able to take no substances, and let's look at how we change that culture. That's interesting. Own your no. You don't have to drink if you don't want to. You mustn't feel the pressure to do it by others. Embrace your sober curiosity in allowing yourself to experience a night without drinking, and you will find that you can enjoy yourself. I think it's important to note that there are ever-increasing number of ways for LGBT plus Q people to meet and socialise, and hopefully this can continue to expand. So some of these activities now are meet-up groups, coffee groups, movie nights, book nights, or book groups, mental health focus groups, walking groups, sports groups, and some activist communities, which again can be very supportive. So be kind. We can support each other better in the LGBT plus community. We can spend time together without the pressure to take drink or drugs. Let's look for natural highs. So as we move on and think about the group, why was the group successful? What's the success? To me, that is the importance of the partnership. Well, our current partnership members, for example, the following organisations that I'm just about to tell you are all the members of our partnership at this time. And they've been there since the beginning. The membership has been open to any organisation who wishes to join either the LGBT plus community, or if it's from a substance use or addictions support fields. Current members, of course, are GCA, Scottish Families, which is STFAD, LGBT Health and Wellbeing, LGBT Youth Scotland, Essex Scotland, or Waverley Care as it's known, the Scottish Drugs Forum, who as I have been there again since the beginning, Scottish Recovery Consortium, SHAP, who we can be grateful to for commissioning a lot of the research that went in, and we worked with them at the very beginning, AFS, or Alcohol Focus Scotland, the Scottish Trans Alliance, Elevate Public Social Partnership, We Are With You, formerly Addiction, the Mungo Foundation, Northwest Recovering Communities, NHS Greater Glasgow and Clyde, and Glasgow Caledonian University, the Sub-Use section. So what are the health inequalities for people in the LGBT plus communities? There are loads of research that's already been done which shows that LGBTQI people experience health inequalities. This is not news. You can go to the KSB website and read a bit more about it. For example, the research that had been undertaken suggests LGBT plus individuals are more likely to drink alcohol and more likely to drink excessively than the general population. Esme was the researcher who I'll speak about earlier, and you can actually see her, more details of her in the information. Trans people are up to 5 times more likely to have attempted suicide than the general adult population, with one study showing 35% of trans people had attempted suicide in comparison to 7% of the adult general population. LGBT young people are disproportionately represented in the young homeless population. As many as 24% of young homeless people are LGBT. This was from LGBT Youth Scotland. US research shows LGBT people experience worse well-being in recovery from alcohol and drug issues. It is important to note that this doesn't represent every single LGBTQI plus experience. But it is important to note that more health inequalities are felt within that community. So why might LGBT plus communities experience worse health, and particularly more likely to experience substance misuse issues than a heterosexual peer? Well, many LGBT people have grown up in an era where their sexual orientation and identity was criminalised or stigmatised. They were bullied for just being who they are. Same-sex relationships were only made legal in Scotland in 1981, and it was only in 2019 that the World Health Organization dropped being trans as a mental health disorder, and as late as 2021, when GBMSM were legally allowed to give blood. So we recognise that some of the people live with these traumas and unresolved issues. We know that the situation has improved, but LGBTQI plus people still lead lives where they are daily confronted with homophobia or transphobia, where they don't feel accepted or comfortable being themselves, and they cannot live without fear or judgment, or indeed the consequences. The different layers of homo, bi or transphobia that exist, which shows the daily stresses that an LGBTQI individual has to cope with. It's clear that you can see how all these different layers of bi, trans and homophobia, as well as thinking of how the community could also interlink with race, class, ableism, etc. These evidence and show the barriers many people face on a daily basis over a long period of time. These layers of phobias are wrapped up in society. This leaves people feeling indifferent, less accepted, perhaps shunned from family or peer group. This can have long-lasting psychological distresses, particularly at the time of crucial brain development in young people. And as we know, these adverse childhood experiences can lead to substance use issues. I'd like to talk about some of the research that was recently undertaken. I want to pay homage to a fantastic piece of research which was commissioned by SHAP, and it was concluded in 2022 by Dr. Elena Dimova, Dr. Rosalind O'Brien, Professor Laurie Elliott, Dr. Jamie Francis, and Professor Carol Emsley. The research offers recommendations for alcohol and drug services to help make their organisations more inclusive. It was groundbreaking in the start of this conversation. I would urge everybody to please go and read that report, which you can find in SHAP-LGBT report, web, final PDF, kinderstrongerbetter.org. Easier said than done. But you will be able to find that on the SHAP website. Some of the key take-home messages from that report are: there is a perception that LGBT people are rendered invisible by service providers because of a heterocentric world. The assumption that everyone is heterosexual and cisgendered. Drug and alcohol services perceived as being macho or intimidating. Services need a greater understanding and awareness of trans people and the community. Services need a greater understanding of the particular way that the trans identity may impact on alcohol and other use. Services need to ensure that trans people know that they will be welcome before they arrive. Services need to ensure that trans people are safe and respected while using them. So what can we do? Or what have we done, I should say? Never assume your participants are straight or cisgendered by saying things like girlfriend, partner, or using he or she. Use more gender-neutral language when speaking. Show you're aware of different gender identities and don't make assumptions. Think about pronoun badges or using pronouns in emails. Don't be afraid to ask somebody's pronoun if you're not sure of it. Include representation of LGBTQI people on websites and other published resources and social media content. Take an active interest in learning about the community and their lives and experiences by undertaking training courses, looking at films, books and additional research. Have effective equalities monitoring in place. Do you know whether LGBTQI people are accessing your services right now? Involve the community in the service design. Are referral forms inclusive? Is the physical space welcoming? Complete the LGBT Charter. GCA, for example, has just went through this, or is currently going through this at a silver level for a silver level award. Everyone is then trained and can have open and honest dialogue, which is really informative for all members. As an organisation, do you attend to LGBTQI events? Are you aware of sober spaces for the community to attend? Can you effectively guide post people to organisations that can help? I'm going to actually read another quote from a report which I think sums up why it's so important that we keep working and keep doing this work to be kinder, to be stronger, to be better. For me, alcoholism is like a disease. It means I am not at ease with myself. That might be a lot to do with being transgender and not being comfortable within my own skin, or just being allowed to be who I wanted to be. Growing up, having to hide things away all the time was a lot of pressure. It's like constantly questioning the things over and over again. Gradually, this gives you mental issues, mental problems. You can get conditioned day in and day out, every day, every morning, waking up and thinking, I can't be me. I can't do this. I can't do that. What will they think of me? I'm only starting to see now that after 3 years of being in recovery and really looking at myself and talking to other people, my head is getting clearer. 44 years of drinking and hiding things, that's probably part of my condition. I've always been ashamed of who I am. That I was transgender or an alcoholic, well, that was the stigma. How the cultural nature of the problem has to be considered to challenge the long-term attitudes and expectations surrounding alcohol. Our development of a service, and particularly the KSB partnership, was aided due to the research carried out by Glasgow Caledonian University and funded by SHAP, looking at the social context of LGBT drinking, as well as research carried out by the Scottish Transgender Alliance on trans inclusion in drug and alcohol services, by stimulating discussion and raising awareness within the communities in Glasgow on the nature and extent of health inequalities experienced by the community, of interest on drug and alcohol problems, and raising awareness of the necessity that alcohol and drug services are LGBTQI aware. There should be more community events and wider opportunities for people to be involved in shaping the future of their community. GCA have now developed a proposal for funding which involved the community members. The project will adopt a co-production approach using expertise of the community member volunteers who will develop and produce the campaign and also ensure their relevance to the community. Additionally, community members will receive training on substance use awareness and delivering alcohol brief interventions, ensuring that they will be able to play an active role in shaping the future for the community, both for the duration of the project but more importantly beyond. We now have our LGBTQ plus recovery group and are expanding this via feedback from members to include new activities as mentioned up above. I am pleased to note that SDF have developed the online training for this now and host it on their website. So in conclusion, I'm sure you'll be pleased to hear, I want to thank everyone for listening to my presentation today and realise that this is a nuanced approach to working with the communities in which we serve. Our goal is to reduce barriers to all communities who wish or need to access addiction support. And this is another spoke in the wheel, as I call it, of person-centred service provision. GCA have been working within the LGBTQ plus community for over 20 years and actually notice and can note the progress that is being made now and how much more acceptance and compassion there is now rather than ever before. I'm always happy to speak if anyone wants further discussion on the matter or any further information from me. Happy to take any questions. My details are available from our gracious hosts. Thanks again, everyone. Bye-bye.